if you're going, there's two patient groups. The one is symptomatic. They know there's blood. Then it's no longer screening. Now you're doing diagnostic investigations. If they can see the blood, if they know there's blood, there's no point in testing for it because it's there. Then you go to the next step, which is a colonoscopy. The question comes, are you screening? Now, the screening group is by definition a healthy, well person that you just want to know, is there a problem coming? And that also has a division in your approach. Are you screening or are you preventing? And I think that's quite a subtle difference, but prevention is not a form of screening. Prevention is trying to avoid the disease, and screening is trying to pick up the disease early enough so that your treatment makes a difference. And when you Google or when you look for how do you find a colon cancer, you have already selected for screening of an existing cancer. You are not looking at the prevention bundle. So back to your question, should you be screening? Yes, you should be screening. I, to my patients, advocate for the prevention basket. So if you're looking at a young, healthy, well-informed and financially able patient who can get into the prevention basket, that is definitely the one you want to be in. And so I'm just going to address the screening basket first. So screening is there to try and find a cancer. Then we've got all these modalities like, do we test for blood? Do we test for cancer DNA, be it in the stool or in your blood? Or do we go do a colonoscopy to find a cancer? There, my answer is, do the test that you'll actually do. Do the test that the patient will go through with. Because a colonoscopy is patients don't necessarily want to do. A stool test patients often don't want to do because it's so difficult and so laborious. And the blood test might not be quite as accurate in all the situations. But do the one you can. If you're going to do one, great. But all those tests end in a colonoscopy. If they flag positive, you should be going for a colonoscopy. So in the private sector, I find patients A are short of time. They want an answer now. And they probably want to be in the prevention basket to start with. So my recommendation is just go straight to the colonoscopy if that's your option. And the colonoscopy has two benefits. One, it's got the diagnostic approach to, it's going to find the cancer. And there it's 99% accurate. You're going to find a cancer if it's there. But the other part that really is important is in 1/3 of the colonoscopies you're screening, you should be finding polyps as an endoscopist. So 1 in 3, if you're meeting the 45-year-old criteria. And in that group of patients, there I feel the colonoscopy is fantastic because in 1 in 3 patients, we're now taking out polyps, which means we're giving them a longer life, A, and B, preventing the cancer. So they're never in the screening group because they never got the cancer. Does that make sense?
Yeah, it makes absolute sense. It's actually more scary than I thought. I mean, I push as hard as I can for everyone to go early for their colon cancer. I mean, we talk about, we started all of this because we are in the same boat. We are moving along in the same boat. And I am actually one of the high risk because my dad had colon cancer that was picked up a little bit too late and that he had to have a piece of his bowel resected. But he's still alive. Yeah. So he was the screening side and then the pickup side, but he was not the prevention side. Luckily, I could push all my brothers and we are all in the prevention side now because,
It's also, I just want to say in case, so between the screening and prevention, I think part of what one needs to understand is because you need something to bleed or to actually shed DNA material for the screening to work.
Exactly.
Whereas in the earlier stage, those tests will be negative.
Yeah.
And that's why it's the prevention versus the screening.
So
it doesn't help you do the screening test and think you're going to prevent it.
Exactly.
Because you won't pick up any issues as such.
So I like to flip it on its head and say, If you have symptoms and you just want peace of mind, then you can do the screening test, because we know that we've established that those screening tests are good for finding really worrying signs. But the corollary to that is, if you have symptoms and that came back positive, you'd probably go for the colonoscopy anyway. So again, we have such an easy route to colonoscopies in South Africa that to me, it's very easy to advocate for them.